Good afternoon, and thanks for joining us. Welcome to today's USC Center for Health Journalism Health Matters webinar, Rethinking Public Safety 3 years after George Floyd. My name is Michelle Lavander. I'm the founding director of the center. We're here today for an important conversation on our nation's progress in criminal justice reform on the eve of the 3-year anniversary of the police murder of George Floyd. His death led to massive protests and fueled a movement that prompted government promises of investments in policing alternatives that would improve public safety and community health. We'll look at how much law enforcement has changed and at innovations that reduce a police presence by putting public safety into the hands of communities themselves. We'll also explore the headwinds that have dampened the prospects for such efforts in a changed political climate today. I'm pleased to introduce 3 distinguished panelists. Sasha Cotton, the Senior Strategy Director of the National Network for Safe Communities. Before that, she worked as a director of the Minneapolis Office of Violence Prevention. It engages with communities throughout Minneapolis to address violence and safety issues using a public health approach and community-centered strategies. Lisa Dogard is co-executive director of Purpose Dignity Action in Seattle, which works to reduce over-reliance on police and the legal system to address public health issues. She's the recipient of a 2019 MacArthur Fellowship for her work in criminal justice reform, and she's the primary architect for the Law Enforcement Assisted Diversion Program in King County, Washington, which has become a national model for replacing punitive policing policies with harm reduction in social services in response to low-level crimes of drug addiction, homelessness, and poverty. Jamiles Lartey is a New Orleans-based staff writer for the Marshall Project. Previously, he worked as a reporter for The Guardian, covering issues of criminal justice, race, and policing. He was a member of the team behind the award-winning online database, The Counted, tracking police violence in 2015 and 2016. In 2016, he was named Michael J. Feeney Emerging Journalist of the Year by the National Association of Black Journalists. This webinar is made possible thanks to the generous support of the California Endowment and the Robert Wood Johnson Foundation, as well as individual supporters like you. A word about our format: we'll be hearing from our speakers first, and then we'll turn it over to our audience for your questions. Feel free to share general comments in the chat. Because we have many people joining us on Zoom, we'll ask you to write your questions for our speakers into the Q&A panel. You also can write us there if you're experiencing technical problems. We'll be archiving this conversation later today at centerforhealthjournalism.org. Jamiles, let's start with you. Your reporting has done just a remarkable job of knitting together developments around the country and chronicling where we are with policing. Paint a picture, if you will, of the law enforcement landscape 3 years after the police murder of George Floyd. How has policing changed, and where have efforts faltered? And what headwinds are you seeing after such early momentum for change?
Yeah, absolutely. And thank you so much for having me. I think I would say what has certainly changed is national consciousness. I think in some ways, public awareness around policing almost has to be thought of as pre-George Floyd and post-George Floyd. What's certainly changed is we had hundreds of state and local level policing bills with new regulations on police conduct. For example, banning chokeholds, creating restrictions around no-knock warrants and raids, bills that require police to intervene if a fellow officer is behaving abusively or to render aid to someone who's injured if the officer is not currently facing a threat. There have been some bills that have touched on accountability, bills that have enhanced the state's ability to take away an officer's certification in an effort to combat quote unquote wandering officers who are basically dismissed from one department for some kind of misconduct or under an investigation, and they pop up at another one. In just a handful of states, there have been efforts to weaken qualified immunity. The court created legal doctrine that offers police a large amount of immunity from civil prosecution for their behavior. As I'm sure we'll talk about quite a bit today, many departments have also begun experimenting with new approaches like alternate response programs that send unarmed counselors or social workers to certain calls. What hasn't changed is the number of police killings, which has been static at a, thinking about it in a per capita basis over the past decade. What hasn't changed is the demographic details of these killings. Most who die at the hands of the police are white, but Black people are overrepresented by about 3 times their share of the population. What hasn't changed is that most police killings don't garner very much attention in the media, certainly at the national level. Occasionally one does, as we saw in the case of Tyree Nichols earlier this year. And then I think there's another category which is what is too early to know. And I think, some of the more granular facts, it's still very early. So are police being held accountable for brutality and abuse more often? For me, it's too early to say. It's certainly true that the problems of brutality and abuse still exist, and officers certainly still evade accountability. But has there been some kind of marginal improvement or not? I think that dust is still settling. And yeah, to the last part of your question, I would say it's undeniable that there is, or at least was, a moment of momentum for reform, at least certain kinds of reform. And I want to be clear here that I mean no value judgment when I utter that term reform. Reform is just a new law that someone thinks will fix a problem. We can't bake in the assumption that it does fix that problem or will fix that problem. But the other sort of word there that I want to parse for a second is the word momentum. And if you've ever studied martial arts, you'll know that momentum doesn't always take you where you want to go, and an opponent is often trying to use your own momentum against you. And that's part of what we've seen too, that as criminal justice policy has become increasingly a part of the culture wars in ways that it hasn't before, that has sort of complicated efforts. And I on a prep call for this talk, I remember I was reminded of Van Jones and Newt Gingrich sitting on a couch together talking about how there's room for progressives and conservatives to come together on criminal justice issues. And it does feel like that feels like a world ago, a universe ago, a millennium ago, but that was less than 10 years ago.
Yeah, well, thank you. That just really nuanced and kind of mixed picture where it's hard to see, the next years will be really telling and seeing where we go. And let's turn, Sasha, to you right now, because you're one of the people who's really pioneered some of these alternative models, and in your case, really rooted in reducing violence and prevention, and operated out of the health department in Minneapolis's Office of Violence Prevention. And now you're working with a network of communities nationally that are working to transform public safety in partnership with communities. Maybe lay the groundwork a little bit for us on how these community-centered safety strategies work and how they reduce reliance on law enforcement, as well as some of the early results that you're seeing.
Yes, and well, thank you for having me. Thinking about sort of the national landscape and my work in Minneapolis prior to the work that I've been doing over the last 6 to 8 months at the National Network for Safe Communities, I think in Minneapolis, there was a deep desire to do violence prevention and alternative work prior to George Floyd's murder. But certainly we saw a significant and deeper interest in building out those kinds of strategies in the immediacy after his death and the unrest that followed. And I think while that kind of interest is super important and helpful to the field, it also creates a demand that's difficult to fill quickly. So standing up violence prevention work, standing up alternative work, if it's going to be done well, takes time. And I think across the country, sometimes the spur to get that work up and running has been used to some of my previous speakers' points to sort of work against the movement, because results are not always available quickly. The work takes time to prove that it's actually doing what it's set out to do. And I think when communities are faced with the kinds of upticks in violence that we've seen over the last several years, there tends to be a default to what people know, whether it's working or not. And that often looks like law enforcement. And so I think we continue to do some really good and important work, both in Minneapolis, because the national network is working in both Minneapolis and St. Paul, around thinking about what an expanded public safety system looks like. So the inclusion of more community-based organizations, the inclusion of social services that are really designed and cater to the demographic that is most at risk of being involved with violence, and not just protecting property, but really focused on how do we help people change their behavior and give them the support that they need to make better and different decisions. That doesn't mean, and I think it's important for us to caveat, that there's not a place or a role for law enforcement. But I think what we want, both at the national network, and I'm here in Chicago right now because national community-based violence intervention organizations, primarily that are working nationally, are convening to talk about this very issue around action planning and what can be done to really embed these strategies in cities across America, what is being done and what can be done to deepen it. And I think what it really boils down to is that the brilliance around keeping communities safe rests with community, and it always has, but it hasn't always been leveraged, they haven't always been empowered, and they haven't always been funded. And so much of our work is about both helping cities to design and develop strategies that can keep communities safe, that leverage a partnership between community social services and law enforcement, but that also really balance what the three kinds of partnerships bring to bear. So I'm grateful to be here and really interested to see how this conversation plays out. But I think the biggest focus here is partnership, and what does local government in particular have an obligation to do around public safety beyond just policing.
And Sasha, before we turn to Lisa, I'm hoping that you could just maybe give us one example. I mean, I think there's a lot of innovation going on right now, which is very exciting, but maybe touch on something that with your work in Minneapolis that would just help everybody understand how a non-policing response might work.
Absolutely. So I'll offer a couple of strategies, examples, but I'll just frame it in the way that our partners at Cities United, which is another national institution that does violence prevention work. And really what we look at is how do we meet people who are most at risk for violence where they are? And usually we can find them in three very particular places. So you can often find those people in hospitals. People who are deeply impacted by violence are often victimized by violence before or during their involvement with, alleged perpetration. And so hospital-based initiatives, which we have in Minneapolis, so our county hospital, as well as 3 private hospitals in Minneapolis, are currently offering bedside intervention. So meeting with people who have been impacted by violence, talking with them both about not retaliating for the violence that they've experienced. So we know that in many cities, over 50% of the violence that's happening, particularly around gun violence, is retaliatory violence, where there's a back and forth dynamic, whether it's between groups or individuals, but that there's a back and forth nature, and that people are at an exceedingly high risk of coming back to a hospital with a same or similar injury once they've come in once for a violent injury. And so really meeting people to reduce that rate of recidivism, visits to ERs, and providing them with a social network of providers and supports to get them back on their feet physically, helping to address the trauma, focused conversations around de-escalating any need for retaliation or thoughts about retaliation. And that's an ongoing process. We know when people are impacted by violence, they are often displaced from their homes, they need mental health counseling, and a lot of those resources are not available, and particularly for communities that are at the intersection of poverty and deep experiences with violence. So hospital-based intervention is one of many examples that's being stood up in Minneapolis and in cities across the country. And I'll be happy to share some more examples throughout the conversation.
Wonderful. Thank you. Thank you so much. Lisa, we're going to turn to you. You founded the Law Enforcement Assisted Diversion Program, which aims to take police out of the equation when it comes to low-level crimes of poverty, homelessness, and addiction. More than 100 jurisdictions across the country have adopted the model. Tell us the theory behind your approach and maybe give us an example of how it works in Seattle.
Sure. Great to be here. So first, a quick observation. Even though when folks are narrating the arc of backlash or headwinds over the last couple of years, often cite to rising rates of violent crime. It is my impression and theory that actually what has driven a lot of that reconsideration of the resolve to radically revisit the role of police in our society actually stems from daily mundane disorder. So not violence, but rather public homelessness, drug use, drug sales, sale of stolen property, shoplifting, low-level property crimes that have been very closely tied to the economic disruptions during the pandemic. And although, I mean, also related to structural inequalities in this country that have been baked in for decades, but no question that, you know, they were at an absolute high watermark of visibility and impact during the pandemic. So it is my belief our work does focus on very high volume, but comparatively low level criminal activity. And I think that that work is really, really catalytic for, you know, for sentiment, if you will, and public policy and pressure on public policy makers. So to me, other work is also very important and very hard, but if we do not do this piece, we're in deep trouble if we want to transform the dynamics that have that fostered mass incarceration over many decades. And that is very challenging because this is such high volume work. We're not talking about a few people struggling with very high impact, but relatively scarce and rare incidents of violence. We're talking about massive numbers of people, tens, hundreds of thousands of people who are living lives where the truth is, it's not like they're being, I'm a former public defender, so I've spent a lot of my life talking about how people are, you know, alleged to have done something or accused to have, but the fact is just a lot of people are committing low-level criminal activity in order to get through their lives, to get income, to obtain substances to which they're addicted, to find a place to live and stay. So we have to have, if we agree, which most people in this country do, in red states and blue states, if we agree that it does not make sense to use punitive enforcement strategies to address issues of poverty and behavioral health, we still have to address issues of poverty and behavioral health, or we create a void that makes people very rapidly, it turns out, nostalgic for when we used punitive enforcement measures to deal with those things. So we just got to fill that space. And that really is what LEAD is for, to not take you all the way down the rabbit hole. There's an original model, which is about, it actually doesn't entirely necessarily take police out of the equation. It's basically neutral. If police are called, which they may be because people are committing crimes, things that are against the law, police do not have to take people to jail. They can let people go to a warm handoff, community-based response that is just the beginning. Like, that's not the thing, that's just the front door to the thing. And the thing itself is long-term case management, a golden thread that supports people to address housing, income, addiction, and trauma recovery issues. So those are really complex arcs. They're not quick turnaround approaches, but because the police buy in to the idea that that's what needs to happen with this person in order to reduce their incidence of crime and their community impact, that person may, you know, be on a long arc of change and not encounter any additional, you know, enforcement, arrest, or prosecution response. LEAD goes back a decade, and it has been widely replicated in that original form. But we, over the last couple of years, have come to recognize that LEAD is essentially what comes second. It's not a first responder. First responder may be police, maybe community members who call. So LEAD provides that long-term care response and coordination. We have increasingly seen that we also have to fill, or someone has to fill, that space of first response that is not police, where it doesn't need to be police. And I want to just put a pin in this point. That needs to happen not just for people in crisis who are understood by whoever called to be, you know, medically unwell or psychiatrically unwell, It also needs to be available for people who are committing crimes, but they're not crimes that police need to be involved in the response to, as long as there's a credible alternative. So we've created a neighborhood-based program called the Third Avenue Project in Seattle. And during the pandemic, we launched an encampment resolution strategy called Just Care. And both of those they use the same principles of LEAD, but they are more engineered to create a feeling of immediate response, felt response. And you can tell if you're a business or a neighbor, whether or not somebody came, just like the police create that impression when they show up and they take someone away, it feels like something happened. We can do that too. We need to do that too. And that's what we've started to build.
And Lisa, just quickly, because this is just such a big topic and we want to have lots more discussion, but I'm just trying to help make this feel more tangible. And I'm thinking of an example where there was like a popular restaurant in Seattle that was completely kind of access to it was blocked off by an encampment, and there was some petty crime around it. Like, can you just give us the nickel summary of how that would be addressed?
Sure. So that particular restaurant was at the center of our work with Just Care, and then now with the Third Avenue Project. There are no longer encampments, which Just Care resolved by arriving, doing outreach over 4 to 6 weeks, identifying what was going on with each person in the encampment that was blocking businesses on this block that we're trying to reopen, and then making placements for each of those people that were low barrier. We're not going to kick them out the next day, recognized the way that they were living, didn't expect that to change overnight, and provided intensive case management teams. That kind of response takes a lot of resources. We did have those resources because of COVID relief funding, and was very popular. After, though, the businesses reopened and that encampment sort of era subsided, nonetheless, there's just a tremendous amount of street chaos, and we need to not minimize that. It's not good. It's a very difficult environment in which to operate a business, and I think that people who want to change, the era of mass incarceration are not well served by minimizing the significance of these incidents. So this restaurant had a boulder thrown through the window that nearly missed a patron. Somebody wandered in off the street, very mentally ill, and when was making a disruption in the lobby, and when a manager came to address it, the manager got pretty seriously assaulted, and the police didn't respond for 40 minutes because they have capacity issues. So that's just kind of non-viable, and I think we can all accept that that isn't gonna work for most people. So this restaurant owner was demanding that local officials give him, a response and new tools. Now, he thought that the tools that he wanted were putting people in jail, holding people accountable, and showing people that there would be consequences, and that this was all happening because there was a feeling of no consequences. We said, let's set aside the how we're going to address your problem. If we do address your problem and the environment improves, will that work for you, even if we use very different tools than the ones that you just named? And he said yes, that if we could solve this problem, he would be okay with us using a very different toolkit. So it's on us to form. We put a team in the Third Avenue corridor that's there from 6 a.m. to 9:30 p.m. They are skilled de-escalators, so they can operate safely in this area where there are a lot of weapons, there is a lot of violence. They form relationships with people, sort of decongregate groups of people that make it difficult for folks to get into businesses, and then start to make connections with other entities that can meet the deeper service needs of that population. And there's a QR code where businesses can scan the QR code and make a referral for an immediate response, and we provide that immediate response. Super popular. And so it's just a question of validating what somebody says is their problem, but saying that we're going to supply a different kind of answer and asking for them to take yes for an answer with these other tools.
Thank you so much, Lisa. I'm going to pivot a little to a different question that has been a source of a lot of civilian police issues and even deaths, and that is traffic stops and disproportionate traffic stops in communities of color. And Jamiles, as you've reported, they're one of the more dangerous interactions that people have with police. And some cities have tried to limit police authority to conduct stops or assign the task to unarmed safety officers or civilians. And yet at the same time, the country is experiencing growth in what are called privatized policing, contractors who provide services like traffic control and sobriety checks, sometimes to deal with police staffing and financial issues. And what questions do you think reporters should be asking when their communities contemplate tasking civilians or for-profit firms with traditional police functions? And where do you see this all going?
I guess, you know, from a journalist point of view, my primary caution, I guess, would be around language. So I think just like making sure that you're being clear about the language you're using to describe things. So replacing sworn officers with unsworn and unarmed police department employees is like one brand of doing a thing. Replacing police department employees with other public sector actors is a different brand of thing. And then truly private actors that are being brought in either a surveillance or security role is different. And within that category, you know, people being brought in to do, again, like a human services approach versus a, you know, maybe I'm overstating it, but like a private militia approach. Those are very different ideas, and they're still private actors who are sort of filling in for this public sector role that people would traditionally expect the police to be involved in. So I think that'd be my kind of biggest and at least first comment to journalists is just, you know, make sure you're being clear about what you're describing.
A little to that, Michelle.
I'm sorry, Sasha? Go ahead.
Can I add a little bit to that?
Absolutely.
Yeah, I mean, in Minneapolis and St. Paul's and the Twin Cities, they've tried to create policy to move away from pretext stops, right? So things like hanging things from your mirror and tabs and, you know, registration violations and things of that nature. Folks might remember less than a year after George Floyd was murdered, Dante Wright was killed in a suburb of Minneapolis, and the stop was for an air freshener hanging from his mirror. And he was killed by an officer who allegedly mistaken her taser for her service weapon. I think the other thing that I always want to caution people about is if officers are not stopping people for pretext, it doesn't mean they're not stopping people. And as you ratchet up the cause for the stop, like what legitimizes it, I think it also ratchets up the intensity. So I just think it's important for us to remember too that if officers are then looking for another legitimate reason to stop the same demographic, if the reason they're making the stop is because someone meets a description, that's different from a registration stop. And I worry about how that interaction plays out. Since that policy has changed in Minneapolis, my son and some friends were stopped. It wasn't a pretext stop. It was for a cell phone, right? That his cell phone was out, right? But the interaction that they had was very negative. And I worry that we're just giving officers, they have to look for different excuses, but it's not actually changing the dynamic of how they're interacting with the public. And so I just want to caveat that while I'm not taking a position on whether or not cities should or shouldn't explore this. I think it is only a very small part of a solution that really revolves around the ways that law enforcement is engaging with community, and how we frame that engagement feels like the bigger picture.
Thank you, Sasha. And if I hear you correctly, you're saying that really, for example, the encounter with your son, the cops are just switching one pretext for another, but really very little change. And have you seen efforts, you know, make some headway that have maybe made more, you know, real progress in changing those kind of dangerous dynamics?
So on the matter of stops, I'm not 100% sure. I think when we think about police alternatives that are working really well in Minneapolis, there's a behavioral crisis unit that is now fully 911 deployable. And it's not a co-responder model. It is just it's not law enforcement at all. If it's a non-violent mental health call for a person in distress, it's just behavioral health professionals who are deployed. They're not deployed in like any kind of lights and flashing sirens, right? They're just showing up in what looks like a van. They're able to offer people mental health services and resources. They're able to, if someone volunteers and wants to be transported to a hospital for medical treatment, they can, but they will never do a mandatory transport. They can also transport people. Let's say I'm having suicidal ideation. I would feel better if I was at my mom's house or at my partner's house. They can provide that kind of resource along with some more longer term follow-up and connection to longer term services. And so I think situations like that where we're changing who's showing up, not just changing the reason that they get to show up, feel more sustainable for actually getting a different outcome, because it seems like we have over-relied on policing to solve all of our social problems, and they're showing up with the same tool, right? And so if we don't change the tool, we're going to continue to get the same outcome.
Yeah, just to build really briefly off of what Sasha was saying, I think other good sort of general purpose advice for reporters and for just citizens in a democracy is, think about the downstream effects of changes that can be hidden. So you mentioned the use of civilian or private entities to enforce some of these laws. One of the other ways that cities have been looking to get rid of traffic interactions is to actually use technology, right? So you can use technology, for example, to mail people a ticket rather than pulling them over and creating the dynamic of that traffic stop. That idea, I think, makes sense intuitively to a lot of people. Like, why not cut down on the context? You're just cutting down the odds. One odd thing that people don't think about is, well, if people have illegal tags, bad registration, fake license plates, that actually throws that entire enforcement system into jeopardy. So I'm describing a theoretical. This is not actually happened, but you could imagine a city going all in on electronic enforcement for traffic, and that then spurring, because that whole thing rests on everybody's car being registered properly, spurring a really aggressive campaign to stamp out fraudulent license plates. Now, the relative trade-offs, cost benefit analysis of that may pan out, it may not. I'm not weighing in on that. But just to think downstream about, once we make a change, that creates a lot of new changes that we're not always thinking about. So, just kind of like taking a step back and trying to view changes from 30,000 feet.
If I can just offer a real-time example of what you're talking about, in Ramsey County, they didn't use electronic means, but they got rid of pretext stops. So they're just stopping for actual vehicular violations. But then that made that number go up, right? So because officers weren't doing pretext stops, they were pulling more people over for minor traffic violations. More people were getting citations, and it was disproportionately people of color. So there's still inherently some bias even when we apply these things. So I think you're right, this looking upstream at sort of unforeseen consequence feels really important when we think about policy changes.
Yeah, I want to just add, I have so many similar examples and I won't inflict them on you, but this pattern has caused me over time to really appreciate the wisdom of whoever said, don't fall in love with your solution, fall in love with the problem, not with your solution. There is so much sort of, if you almost gimmicky, idea of the month, let's do this. And those can be both incredibly costly. Communities don't have infinite resources. So every time you build a new X, to do something, it takes a long time, it takes a lot of investment, it takes a lot of resources that maybe fundamentally need to be dedicated to alleviating the dire circumstances that many people find themselves in, making them more policeable, which is a concept that Forrest Stewart at Stanford has been using. The be careful what you ask for phenomenon, where the flavor of the month actually makes people more vulnerable and they suffer greater losses, tends to come from the fact that a lot of these solutions are not designed with reference to what people actually live through. They're generated by academics, they're generated by, advocacy organizations. We really have to field test this stuff with, after, as Jamal said, after 3 years of this, what is life actually going to look like for the people who are currently suffering? And how confident are we that it's not going to be worse, but in a different way? We should pass that test.
And I just want to point to what we all know is really one of the most dire effects of policing that's just not working, failed policing, which is officer-involved killings of civilians. And they're on the rise, and Black people face the heaviest toll. The Washington Post identified 1,100 fatal shootings by police in 2022, which is the highest number since the newspaper started tracking those deaths in 2015. And I just want to take a moment and ask all of you what you see as the effects of continuing police violence on both community health and the ability to come up with viable public safety models.
I'll chime in, and then I hope that my co-panelists will have some thoughts as well. I think in the immediacy after George Floyd's murder, I think we really expected for things to all of a sudden get really so much better, that, policies would change, we would come up with a solution that everybody was focused on arriving at. And I actually think we've arrived at more apathy in the last couple of years. I think I have heard more from people that I know in law enforcement taking a position that's sort of like, well, we know that there's another one coming. We know there's, they're basically an acceptance that officer-involved killings will just happen. And I think that is one of the challenges that we don't necessarily have I don't have a solution on how we change that, but I think it's not a training issue, right? I think part of it is, how do we narrow the scope of what officers are actually responsible for? Because if you show up to a scene, even if theoretically people are unarmed, when police show up, there's a gun on the scene, right? That brings a gun to the table. So that's just a dynamic. When there's more guns, right? We just have to know that and anchor ourselves in that. So I think reducing the number of calls for service that law enforcement is deployed to is one part of what we need to be thinking about, but then also identifying the right people to be trusted to work in law enforcement. And that doesn't mean that the people who are doing the work right now are bad. I'm not inherently saying that, but I do think that the skill set required to have the kind of discretion to change those numbers that you mentioned, Michelle, we're not achieving that. Without some universal guidelines about what is required to go into law enforcement, without some universal guidelines around what we're looking for law enforcement to do, state by state, city by city, that varies in this country. And that does seem to be problematic when there's no universal framing for what we expect from law enforcement in this country. So there's just one thing that I'll offer up, but I do think that sort of systems apathy towards this issue and an acceptance that it's just part of the way that business gets done is very discouraging to me, and something that I've heard more of recently than I think I did pre-George Floyd.
Thank you.
I'll chime in, not related to our work on community safety alternatives, but related to work I've done on police oversight and accountability. I will just say how important the observation that you both just made is, that we have to conclude something from, how many consent decrees, how many years of consent decree oversight, and how many cities have failed to reduce the incidence of police use of deadly force under concerning circumstances. So I would say it's time to try another some other approaches. And for me, and this is like, there's a fork in the road, and I really do fear that we've not in general gone down a very productive fork, which is asking police themselves how they explain problematic instances of use of deadly force. I know from my own work that in many cases where they feel that they're in a safe space, officers and commanders do identify them. They have discomfort with incidents. They have their own theories why they happened. They have their own theories of what should be done in order to make that situation not happen again, not recur. Nobody asked them, except in like their voices are generally heard in these discussions, not as potential experts or people with insight, but rather as people who are in jeopardy of either collective or individual reputational loss of career. This is very different from the way that, you know, and I'm not the first person to make this observation, but when there is an unexpected death in a hospital setting, right? This is always understood to be something that you want to take a forensic look at, like, how did this happen? Why did it happen? Could it have been avoided? But it's not done in a context that has a presumption that someone's about to lose their job. And as a result, there is a willingness to share insight and a willingness to unearth and surface dynamics that are really only known to those inside the organization and inside the culture. What are the pressures? What is the instruction? What were the stresses? What was this person taught? We need to know why decisions are made, and oftentimes the people best equipped to explain that are people within the practice of policing. We are as far from being able to tap that insight as I feel like we've ever been, because of the you know, the polarization of these discussions. I think that's a shame. I do fully understand why people tend to jump to, well, who's going to get fired? You know, someone's got to get fired. But I do think that it drives real insight underground, and our ability to achieve change is compromised by the fact that we don't create a safe harbor for that information to come forward.
I'm going to turn in a moment to some excellent questions we're seeing, but Jamiles, did you also want to address?
Yeah, I did want to jump in and offer, I hope, a slight you know, antidote to the kind of cynicism that Sasha mentioned hearing, and I've heard plenty of it myself, which is that, you know, while the number remains static nationwide, we have actually seen, I'm not going to call it dramatic, we've seen substantial changes in the breakdown of where fatal police encounters are happening. So we've actually seen a reduction in police shootings in urban settings, and that is something to look at and try to understand, you know, what changes have departments gone through that have caused that. And the reason why the number has remained the same, you know, even despite that, is because the number of shootings in rural and suburban departments has gone up. So I guess I'm saying that not to say that there's a true perfect answer out there if we can just, you know, if we can just find that gem and uncover it. But just that, you know, departments do sometimes make dramatic reductions to the number of people that they shoot in any given year. And that's important to just sort of keep sight of, and not lose it in the national picture that we need to be following at the same time, of course, you know, that this problem is pervasive.
Thank you. So I just want to remind our audience that you should feel free to put your questions in the Q&A panel. And I'm going to just read out a few of them. We have a question from Tom Lydon for Sasha Cotton. He asks, what are some of the obstacles you encountered with violence interrupters in Minneapolis? It seems like there was mistrust from both Minneapolis police and some community members. Also, it sounds like there were difficulties in sharing information and intelligence.
Hi, Tom. So I think that in any institution, when we're trying to change who is responsible for public safety, and particularly when we're trying to put the responsibility of keeping one's community safe in the hands of people who had previously contributed to increasing the violence in their community. So many violence interrupters, for people's background, are people who were formerly involved in group violence or other dynamics that drove violence in their communities, who have then gone on to change their lives, who want to give back, who understand and know the street dynamics and want to contribute to keeping their communities safe. I think that people are inherently suspicious of why and if it's capable. And we have ideas about who is given responsibility, but more importantly, who is allowed to receive payment, who is allowed to be paid to keep communities safe. And I think so often when we think about the system of public safety and particularly policing, it is historically felt like an outside entity in many places, and particularly in Minneapolis. It has not been that the community has been paid to keep itself safe. There's been sort of an outside force. Most Minneapolis police are not Minneapolis residents that is allowed to come in. And so I've always pushed back on that and said, so it's fine for suburban and rural men and women to come into the city of Minneapolis and be paid to keep the community safe, but it is not okay for Black and brown men and women to keep their own communities safe and to be paid by the city to do that. So I think that that was a linchpin, right? And I think anytime you're trying to build something new, there's natural skepticism, although violence interrupters have existed for over 20 or 30 years in cities across America and longer than that informally. I also think that there was a lack of understanding about what violence interrupters were to do. I think historically community groups have in Minneapolis and other places been encouraged to walk and work side by side with law enforcement. So almost in like a community engagement capacity. And that's not what violence interrupters do. Violence interrupters are charged with interrupting and de-escalating violence independently of the police. Now, they should be receiving a one-way stream of information about high-risk individuals, high-risk communities that violence interrupters can focus on. And that information can come from systems, police systems, hospital systems, right? We know that there are points of contact that should feed into who's at risk. But I think what often our criminal justice system expects is if you're a part of the system, then you also report back up, right? And we know that for community violence interrupters, it doesn't work that way. It can't work that way. One, it puts violence interrupters at risk for their own lives if they don't have legitimacy with the people that they're working with on the ground and in the streets, or if they're seen as confidential informants. And I think that that was a huge rub and very difficult for people to understand those boundaries. And maybe not so hard to understand, but to respect those boundaries. And so I think at a time where the Minneapolis Police Department was under a lot of scrutiny, violence interrupters were developed in Minneapolis as a direct response to the murder of George Floyd, that there was a level, I'll just be honest, of resentment from the law enforcement community about feeling that this was a strategy designed to replace them. Not that there's an ecosystem of public safety that there's room for other players in, but that they felt challenged by the development of something new. So I think that those are sort of the systems aspects. I think from a community place, people were skeptical about anybody who was being paid by the city because they worried about whether or not their intentions were pure. If you're getting government money, how are you being co-opted? I also think, like I said before, people who come from those communities who have done the heavy lift to change their lives also have their own historical relationships that aren't always great in community. So if I was once terrorizing community, I have to prove that I am trusted and I'm actually here to do good for the right reasons. And so I think some of the skepticism from community was fair and reasonable. And I think that there's a change in feeling about, I think that there was an overwhelming support from community first. I want to ground in saying that, but there certainly were people who were skeptical. And I think it's the work of non-enforcement strategies in the city to really be working in partnership with community about what these strategies do and to receive information if there's legitimate concern, because there will be, right? In anything, just like there are cops who do the wrong thing, there will be violence interrupters who take advantage of their opportunity. So we're not saying anybody is all purely good in any of this work, in any field, but we have to have a stream of communication between community and the systems that are paying for the work to ensure that if something goes wrong, we hear about it, just like we try to have police accountability. But also there has to be some faith given both by communities and systems that public safety can look like more than just policing. And I think that those are some of the challenges and rubs we faced as we implemented the violence interrupter work in Minneapolis.
Thank you, Sasha. We have a question from Ryan Levy who asks, what level of optimism do the panelists have about the different crisis response efforts communities are implementing to reduce law enforcement involvement in mental health crises? Are they working, and are there any standouts?
I mean, I already lifted up the BCR in Minneapolis, and the reason I won't take long because I feel like I've talked a lot already, but I think it's important for folks to understand the difference between alternative response and violence intervention and prevention. Violence intervention and prevention, like violence interrupters, are not 911 deployed. They are doing their work based on relationships. The BCR in Minneapolis is 911 deployed, which means it's embedded in the city's system, and that 911 operators have to know how to code and properly deploy those resources. Both are really important, but it just seems like an important distinction for people to understand. And I think that the BCR as an alternative to 911 calls for mental health is an incredible model and one that should be looked at more.
And just remind us what BCR stands for, Sasha.
Sorry, behavioral response. I wrote it down because I knew I would forget. Behavioral crisis response.
Oh, great. Thank you. Anybody else want to share what they feel optimistic about or some standout initiatives?
No, but I guess the one thing I would add to that conversation is that I have observed an interesting dynamic, and it's anecdotal, so take it with a grain of salt. Dynamic within police departments, and finding that it often police management, especially police chiefs in big cities, but really anyone in the sort of managerial class of policing, tend to be very enthusiastically in support of programs like this and love the idea of taking things off of officers' plates so that they can focus on solving crimes or deterrent, or whatever they think the sort of proper role is for police officers. But as Sasha mentioned, I think when there is law enforcement pushback to these programs, it comes more often from kind of rank and file, and this sense of feeling like their authority or their importance is being encroached upon by these other approaches. So I don't think that dynamic works certainly in every case. But it's something that I've noticed in my reporting around some of the stuff that there are some very enthusiastic support among police leadership for these kinds of approaches.
I do want to call out, well, actually first, in terms of crisis response, I do want to name again, I think the downside of the good things that are happening in a number of communities is that calls are routed based on whether they are categorized as criminal or not criminal. And I think that bakes in incredibly high odds of exacerbating racial disparity, because it's very dependent on who is viewed by the caller as being in crisis versus committing a crime. And people can be in identical situations, behaving identically, but we know a lot about the way implicit bias allows people to see, oh, that person is ill and needs help, versus that person is scary and is committing a crime. They could be in identical circumstances, but the Black and brown folks who are mentally ill or in grave distress, living unsheltered, are much more likely to be categorized by callers as committing apostle trespassing or drug using, as opposed to there's somebody who just seems to be like passed out on the street. So these frameworks must include people who can be described as committing crimes, but those are obviously related to behavioral health or wellness issues. And those resources need to also be available to people who are initially identified at the point of dispatch as committing a crime. Okay, I'll get off the soapbox. Really, in addition to the stuff that we've been trying to build out of LEAD and that is being explored through that framework around the country, the PAD initiative and 311 in Atlanta is, I think, really worth looking at. It is not 24/7, so it's always hard to offer a first response that's spotty because people don't get acculturated to, oh, I just call 311. Some days, sometimes I can call 311, but people who do can get a non-police response to a fairly widely defined set of circumstances. And the folks providing that response are really incredible and deeply community-based, harm reduction infused, long-term care connectors. So I think that's really encouraging work.
Thank you. And we have a question. I'm sorry, go ahead.
Something up really quick. Because I talked about the BCR, which is a 911 alternative response to police, but I think, and I talked about what violence prevention is, but I think violence prevention is such an important part of thinking about what models exist: hospital-based intervention, violence interrupters, CBT, so cognitive behavior disorder for folks who are high risk for being involved with violence. We know that in most major cities, it's only about 0.5% of the population that's actively involved with the violence. So even when we think about law enforcement, who they're focused on is usually not just the people who are involved with violence. It's big swaths of community. So I just think it's important for us to contextualize that there's a continuum, that violence prevention and intervention is critical, these alternatives are critical, and that on the back end, that's how we get to a place where we're narrowing the scope of what law enforcement is actually required to show up to. Because if all those systems are structured to show up first, it really helps us to lean out what law enforcement has to be showing up to, which I think can lead to better outcomes around safety.
And Jamiles, were you going to say something too? No, okay. We have a question from Sammy Kayola, who asked for suggestions for Public Record Act requests we can file now for future police accountability stories. What sorts of data should we be tracking down? And I would also, with Sammy's hopefully okay broadness, to say what, just for all three of you, what trends and story ideas would you recommend for the reporters joining us today? Start with data, so we answer Sammy's question.
That's a good question. Public records, it's tricky, right? Because I assume when you're asking the question, you've probably thought of all the obvious things. So the obvious things are asking for emails related to this, the rollout of this or that program. Asking for metric data if they're keeping it related to the rollout of this or that program. Usually they are. I think it's often good to think more creatively about public records requests, because oftentimes the most interesting stuff is the stuff that you get by sort of having more of an inside sense in that particular jurisdiction of like who's talking to who about what data probably exists. So like it's a difficult question to answer like in the abstract without knowing the details of the department. But those are a couple of the places that I'd start, right? Like new programs, just think about what records probably exist and give it a shot and have a good lawyer.
Anybody else have suggestions on things that maybe even questions that reporters aren't thinking to ask in lines of inquiry more broadly?
I mean, I guess one thing would be, I mentioned earlier, there's been hundreds of reform laws passed at the state and local level. And I think each one of those is an opportunity for, right, many of them were passed 3 years ago now, is an opportunity for looking at what did or did not change. And I think we only get the national picture about what has not changed by lots of journalists at the state and local level, like doing the granular work of trying to suss that out. So as someone who like compiles a newsletter that tries to thread things together, it's in some sense, it's a very self-interested response and saying like, report that out at the local level. Like they passed this bill, what happened? I also think, I mentioned briefly this thing about technology. I think the intersection of police staffing issues, their budgets, and how they're deploying tech to try to fill gaps, to using technology as a means of reform is like is a sort of a vanguard. Like there's just not a ton of reporting. A lot of the reporting that's being done on is being done by kind of techie outlets for the most part. And I think there's a place for local newsrooms that know the departments, know the community, to start looking a little bit more closely into these new tech solutions that are emerging out of policing.
Thank you. Any other suggestions before we go on to maybe Bradley Craig's question? Lisa or Sasha, any suggestions for reporters in the room?
No, I think Jamal summed it up as best as anybody could. It's tricky for sure.
And I just want to mention something, Jamal, that you did, which was to look at how, certain kinds of supposed reform efforts are maybe not what they seem to be. And this was your reporting on maybe sort of hidden police union backing of certain kinds of reform efforts. And as we're talking about reporting strategies and things to watch out for, maybe you could touch upon what you found there.
Yeah, and I so appreciate that question. I don't want to take undue credit for the work of the investigative reporters who covered this. I highlighted it in my newsletter, but so this was and by the way, newsletter closing argument at the Marshall Project. Please sign up. But this was mainly tied to a specific case in Austin, Texas, where a police union appears to have founded a dummy organization, astroturfed in canvassers, and in order to promote its own watered down version of an oversight bill that had already been put on the ballot as a ballot measure. That election actually happened like a week or two ago, and the voters approved the non-fake version, the non-police union version. Yeah, I mean, in other cases, police unions are notorious for running their own candidates, sort of recruiting friendly candidates for various oversight boards and positions. And I guess I want to be clear that, like, in the context of our country, this is all perfectly normal political behavior, like, for better or worse. Groups do things like this all the time to try to gain power and win elections in ways that are beneficial to them. But I think the point here is, right, that these unions are political actors, and to treat them as such, like they're doing work beyond simply collectively bargaining on behalf of public sector employees. Like, they're doing more than that.
Yeah, thank you. Let's turn to a question from Bradley Craig, who says, what do we know about the prevalence of violence or threats against non-police crisis responders? Some argue that police intervention may be necessary, but if the non-police responders often succeed without incident, that would have required police that would support the benefits of such approaches. And I think, Lisa, you had some thoughts on that.
Yeah, this is a great critical question. First, in terms of prevalence, it's a huge issue. It cannot be minimized. Yesterday, our medical director had somebody wander up to her car as she was on her way to make a presentation with a gun in his hand, and knocked on the door of her car. And this type of thing is fairly routine in our work. And as an executive director of an organization that sends people out every day to do that kind of work, I just have to say, like, the weight of what could happen and how hard it would be to live with myself if I sent people into unsafe situations without a good plan cannot be exaggerated. As well, there are organizational individual liability issues that I don't think that we've even scratched the surface of. There need to be provisions in every state that immunize organizations that are doing community-based public safety work from liability for basic, unfortunate events that befall either third parties or staff when due care has been taken. The world in general views this kind of work as inherently dangerous. You're going to go out and you're going to work with people who are known to commit crimes, known to commit violent crimes. And we do have to do that. We do that. If that is viewed as per se risky to, then if anything wrong happens, the organization itself is super vulnerable to suit and can't get insured. It's just really, practically speaking, very difficult to operate these programs in the current regulatory realm, and we need to make legal and regulatory advancements to create a safe space. Anyway, so it's a big problem. how do we keep people actually safe? We have not had an adverse incident. I'm just going back, my organization started doing, we've always contracted for street-based work, but my own staff started doing this work in 2020. So I can just say, you know, how have we done? Nobody has had an actually adverse incident. There have been threats because people are mentally ill and people are, and also there are just an enormous number of weapons out there. So the threats are not you can't dispense with the threat with the hope that it's all imagined, you know, that people don't have the capacity to make good on threats. People do. But our workforce stays safe by staying true to very specific safety strategies and practices that they have evolved and that our supervisors teach and direct and reinforce constantly. One of them is that we do not co-respond, to Sasha's point earlier. The impression, and we, you know, we coordinate with police a lot, but we make agreements that they will not show up when we're working a site or working in an area, because it is crucial that our teams not be viewed as extensions of law enforcement. They are moving in and among people who are committing all kinds of illegal activity, but, you know, preeminently and almost universally drug use. And it needs to be understood that if people are giving them information or spending time with them, that they are not making themselves or other people vulnerable to enforcement. That basic rule of thumb, that we are safer without having police show up, and that that's a safety strategy, is really hard for law enforcement to hear. And I totally do understand that, but it is not, it's a pretty day and night issue for us, that we cannot safely do this work if the impression is created that it leads to an enforcement strategy against somebody who is adjacent to the work that we're doing. So it can be done safely. It is being done safely. There's like a whole architecture of how to do it, and no, it does not involve calling police to the scene.
Can I just echo so much of what Lisa said, that I think often the highest risk is the co-responder piece, or when there is implication that our staffs are working with law enforcement. That is actually what puts staff at the greatest risk. For our work, most of the people that are doing, whether it be the group violence intervention support and outreach, which is what we lead at the national network, or violence interrupters or hospital-based workers who are doing work in community, we do a ton of training to support people on, you know, recognizing safety and risk. And we really encourage people to go out in numbers so that there is not just one-to-one work happening, but that people are showing up with numbers, which obviously adds some layer of safety. But so much of what they do is rested upon their relationships and their credibility in that community. And that's why the police relationship dynamic is such a vulnerable one, because if they're, as Lisa said, if they're tied to the legal system and could be seen as a snitch or a confidential informant, it's really risky for them. But also they come from these streets, right? I mean, most of the guys who I worked closely with in Minneapolis are guys who they were active gang members in their past. And so they can read a dangerous situation. They, of course, have been trained in de-escalation and conflict resolution, but they have some natural intuition from having lived that lifestyle too. And so I think really thinking about who we bring into this work and who is credible is also really important, because they know the communities that they're serving, and that is a tool, but also they're not getting the recognition that they deserve, because we are asking them to go out and respond to the same level of danger as law enforcement with literally their relationships and their training to protect them. They do not have a gun and a badge. They get paid dramatically less. They usually are not getting insurance and benefits. They're not a part of a union. So when we think about just sort of the breadth and scope of what public safety looks like, we are asking folks to do immense work without nearly the kinds of protection, let alone the immunity that law enforcement is provided with.
Thank you. I think we'll make that our last question. Jamal, did you want to add something about this question about how this is all shaking out with the nonviolence alternatives versus police and what that suggests for the future of these options?
No, I think Sasha and Lisa covered it beautifully.
Yeah, well, I want to thank our three panelists, Jamiles, Lisa, and Sasha, for their really insightful comments, and to the audience for everybody's excellent questions. I'm sorry we couldn't get to all of them, but this has been a really important conversation. I want to thank also contributing editor Fran Smith, Ryan White, our content editor Cassandra Garabai, our engagement editor and communication strategist Apurva Bishu, all here at the Center for Health Journalism, for their work to help produce this webinar. We'll be sending everyone participating here a survey asking for your feedback on today's program and for your ideas and other topics of interest. And please take a moment to complete it. We also urge you to help support our Health Matters webinar series. You can find more information here on how to do that. We'll be archiving this webinar a little later today at centerforhealthjournalism.org. Thanks so much for joining us, and have a great day.